your knee joint, I'm going to find a nerve there? That's mind-boggling. But the system's going to try to capture people. I might sound insane, but I'm telling you, they're not patients. They're captives. They are captives. They are being held hostage without their own capacity to recognize that. That's why you get your sixth fusion. That's why you get your sixth hip revision. That's what's happening. This is the real world. So, when it comes to the sciatica, let's go back to that concept, the Yass method. Why are they having pain? Why is the sciatic nerve being impinged by the piriformis? Because they don't have enough strength in all the muscles required to perform the functional task. Go back again. You're going to find this is going to be a very reoccurring thing. What muscle is going to strain, which is responsible for keeping the pelvis level when you're single leg standing? Gluteus medius. Right. I want you to look. You get a chance to reference the book. Muscles create their greatest force when they're in the optimal position to do so. When you're talking about keeping your pelvis level, it's a muscle that has vertical fibers, which is the best position to be in to create the force. So the gluteus medius is in that position. The piriformis is more diagonal, so as a result, it doesn't have the capacity. That's why when the glute med strains and the piriformis tries to compensate, it will break down and elicit pain. So even something like sciatica, which people are being told is coming from the lumbar spine, it's not lumbar, it's actually hip dysfunction. It's actually hip dysfunction. So the general premise is, as I said, to the method, which if you would want to embrace and use the method, is that pain is an indication of a tissue in distress. Your job is to identify what tissue it is. The primary reason most people are having pain is because they're trying to work against gravity, all the muscles aren't strong enough, and that's why they're having it. Now, let's go to this. Is there a rare occasion where someone does have a structural variation? The answer is yes, but you have to give me the presentation of it. So, if someone wants to say that arthritis is the cause of pain at the knee joint, as we discussed, arthritis, everyone is being told, big money on arthritis. Inflammatory, everyone loves the word inflammatory. Inflammatory is Celebrex and Thermacare with Shack, now with the electric stim units and all that stuff. On the other side, on the Eastern medicine, we have turmeric, right? So now everybody over there is pushing that. Inflammation, multi-billion-dollar industry. Tell me, is there a physical presentation when inflammation is present? If you sprain your ankle, what happens to your ankle? Oh, that's right, swelling, that's right. Is it hot or cold? That's right. Oh, number two, and pain. Heat, swelling, and pain. Three components, symptoms that must be there to say that you have inflammation. If I hit you with a baseball bat in your shin, what do you see? Swelling, heat, pain. If you unfortunately got bit by a bee and had an allergic reaction, what are you going to see? Swelling, heat, pain. You have a pimple. Swelling, heat, pain. You're having a heart attack. Is that inflammation? That's cell death. How about a kidney stone? That's the inability of a cholesterol molecule to get through, right? So clearly there are opportunities to have pain and it not be inflammation. So this concept of some sort of synchronous, that the words somehow are the same, they're morphed together, pain and inflammation, is a bunch of crap, man. And your job is to identify when it's pain and when it's inflammation. In the vast majority of cases, when someone's having pain in their butt, I mean, not that you're really looking carefully, but if you look close enough, there ain't no swelling, no heat. I mean, I do this 23 years, I've been doing the same stupid story. There's no inflammation. No inflammation. If there's no inflammation, why is that person being given methyl dose packs? Why are they giving Celebrex? Why are they being given cortisone shots? It's insanity. Insanity. Your job is to differentiate. I am meticulous about the words I use. Words have meaning. You want to get trust? You want people to come to you and say, you know, that orthopedic says something about, my God, I trust you. What you say makes the most sense. Use the right words. Use words that are true. Use the words that truly describe exactly what that person's experiencing, and they will trust you. I have people coming from all over the country now to see me. I mean, it's just crazy stories. Now, they trust me. They trust me. They know what I say makes sense. And that's what we're going to do. We're going to take back the system. because what I say is the truth. It is irrefutable. It is an interpretation of the body's symptoms. So, how late can we start? I know you're going to have patients at 2?
Yeah.
Okay, so maybe I should just stop there and see if anyone has questions. Should we try and do that? Does anyone have any questions, or you want me just to keep babbling on? Because I can go. You just turn this on. I'll be here for 3 days. It don't stop. Let's talk about, so we've talked about arthritis. I really I try to get across the big hits, the heavy hitters.
So the core is actually assessing the muscle, which is eliciting all of these symptoms.
Yes. In the majority of cases. So the first thing you do is you look at range of motion, and if you're looking at a peripheral joint, and if there's range of motion, you can ignore arthritis. There is no such thing as a structural variation. Let's talk about something like, I'll give you a great example. This just happened. And again, insane. Lady has ITB tendonitis. She's always had ITB tendonitis. It's been like that the whole time. And somehow she's convinced that she needs a knee replacement. Somehow there was some altered thing. She gets a knee replacement. After the knee replacement, she still has the ITB tendonitis. It's insane. But here's what when she came and she explained her symptom, I understood why she got the knee replacement. She said that as she goes to extend her knee, she feels a crack. Bam, right there. And then she could go through. But right at that point, it's painful. And you can almost hear the crack. So if the symptom is in the joint, and someone shows you a picture of a structural variation, obviously, you're going to be more apt to accept that. But what I would try to convey to you is that joint surfaces are located based on the pulls of the muscles that pass the joint and move the joint. In her particular case, she had a strained quad. And if you look at the quad, through the quad tendon, to the patella tendon, down to the tibia, what happened was there wasn't enough force, and so that tibia wasn't running exactly the way it should, and that's why she was catching it. I did one treatment, massage out a quad. This is a 70-something-year-old woman. She did knee extension. I had to do squats with resistance. And I'm telling you, at the end of 2 hours, man, no pain, no catching, nothing. Because I recognized that although the symptom was in the joint, it wasn't the structure of the joint. It was the way the joint surfaces were running. I'll give you one probably one of the most extreme knee cases I've ever seen. Never seen anything like this before. This guy came to me. If he tried to extend his knee, you literally heard crack, 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 that loud. And he would go, no force. This man's just trying to lift his knee up. And when you looked at him, the cool thing was, if you looked at the size of his quad, it was probably a third of the size of his other leg. Like a third. So what I came to understand was that, you know how you talk about, you've been taught the VMO thing? Like, forget that ever happened. The VMO is a meaningless statement. It's just a dumb phrase. It doesn't mean anything. Think about the premise. 99% of your quad is over here, and the VMO is over here. And somehow, because of its lack of strength, it doesn't seem to be able to match this massive amount. That's your problem? It's insanity. Here's what you want to understand. If your overall quad is much stronger than your hamstring, what's going to happen to your quad? Lengthen or shorten? Shorten, right? Shorten. Your quad's attached to your kneecap, right? What's going to happen to your kneecap? I create this upward force. What's going to happen to that kneecap? Is it going to just float, or is it going to be excessively compressed? Excessively compressed. You bend that knee, you're going to have writhing pain. Okay? So the answer to that situation, stretch the quad, strengthen the hamstring. Two treatments, the person's out of pain. Yeah.
I don't mean to. So when the person is always prescribing squats,
yes,
it always seems like the general overall thing.
Right.
You'd be strengthening the quad.
That is correct.
You'd be making the symptom worse, wouldn't it? I mean, if it's...
it depends on these particular cases where I promoted squats, they had strained their quad.
Right.
The worst thing you could ever happen to you for your knee is get surgery.
Right.
Is get surgery. Because the immobilization that comes post-surgery, you are weakening that quad. Nobody understands how to strengthen the quad. Most facilities, fitness, all of it, don't even understand the idea of progressive resistance. If I got a moment, let me just talk about that very briefly. So anyway, in this particular guy's case, what happened was I strengthened his quad. And over 1 week's time, 1 week, 5 days. At the end of 5 days, that dude could do this with no pain and no cracking, zero. What I had done was his quad had weakened to the point where his kneecap floated, because your quad's actual center of mass is lateral to the knee joint. It actually shifted it. His kneecap was running over the lateral femoral condyle, literally running over it, causing indentations and grooves in the back of his patella. That's what you heard. Crack in, crack in, crack in. And by strengthening his quad, I shifted his kneecap to the center between the intercondylar groove. It didn't matter that he still had that structural variation. It would run the way it was supposed to. No pain, pain-free.
So, how long does it take to strengthen that?
Most of my pain, see, because of who I am and people coming, I get 3 to 5 days.
Okay.
I get 3 to 5 days to get them damn near 100%. Now,
How do they maintain that?
they have to do the exercise program. You have to understand how to exercise. The thing I would tell you about, if you think doing exercise gets people better, you're out of your mind. It ain't the exercise. The exercise is a framework. Why do people have pain? The Yass theory. They don't have enough strength in all the muscles required to perform functional tasks. How do you make muscles get stronger? Cause them to adapt to greater and greater resistances. So stop thinking that doing an exercise is your answer. If you're not causing them to get greater and greater resistances, causing the muscle to adapt and make more muscle mass, you are doing nothing. You're doing nothing to help them.